There is so much going on in celebrity plastic surgery today, especially with three celebrities who have made a lot of news. The first one you may have heard is that Kris Jenner has emerged after kind of disappearing for a few months, looking literally 20 years younger, as if she is one of her daughters. The second celebrity that's made news is Doja Cat with a breast implant malfunction, which she had no problems basically talking about and leaving it out there while she was performing. And the third one is Chrissy Teigen, who has recently admitted to a forehead shortening operation. So we're going to break down these procedures on this podcast today. What are they? Are they things for you to consider having done, and more? Okay, so this was a podcast that I have put together kind of last minute because there have been three celebrities who have made a ton of news lately on the procedures that they've undergone. And the first one I'm going to focus on is probably the one that's most out there that people are just like, it's like jaw is on the floor when they see her, and this is Kris Jenner. So Kris Jenner has made headlines recently as she has really, disappeared for several months and has reemerged in the last couple weeks looking incredibly youthful. Like I pause because it's like there are almost no words to describe how different she looks. So if you take a look at photos of Kris Jenner and even videos on her Instagram now, you will see that she has a nearly impossibly sharp jawline. Her jowls are gone. The loose skin under her neck is gone. Her cheeks look nice and lifted. Her eyes look more open. Her brows may be a little bit elevated, and she literally looks as if she is one of her daughters. And I am not exaggerating at all. So I would encourage you to take a look at some pictures of her because it is pretty astounding. So I pulled some old photos of her, and last I saw that I was able to get a hold of were photos from about a year ago. Now she has reemerged after not really being in the public eye for at least 6 to 8 months. And now she looks very, very different. And so I really want to bring that up to you of like, what is going on with Kris Jenner? So the first thing, and I think the most obvious thing, and her publicist has even gone on record as stating that she has undergone work by a doctor, a plastic surgeon from New York City. And really then the question is what has she had done? And the first thing, and it's not surprising, is that she appears to definitely have had a facelift. For those of you who don't know what a facelift does, is a facelift is an operation that lifts the cheeks, the lower face, and the neck. But it does that at the expense of permanent scars in front of and behind the ears. So this is a big surgery. I do a lot of facelifts in my practice. They take me about 3.5 hours. We call it a lower facelift because it mainly treats the lower face and the upper neck. But what essentially this does is it creates what you see with Kris, the cleaned up lower face and the neck. She has literally a jawline of somebody who looks 25. And so it looks pretty impressive. Now, some people are claiming that this may be a deep plane facelift. You can't really tell looking at a patient what type of facelift it was. Was it a deep plane facelift? Was it a smastectomy facelift? Was it a smastplication facelift? There's a lot of different ways to do facelifts, but all of them do create scars in front of and behind the ears. All of them lift the lower face and the neck. They elevate the muscle, and they also at times remove unwanted fat, like from the jowls. Now, some people, once again, are claiming that this has to be a certain type of facelift over another one. I disagree with that. We study facelifts at our conferences. I do them literally every week or two, and you cannot tell the difference in facelift technique by just looking at it before and after. It's just not possible. As surgeons, we may get an idea when we do the operation of who could be a good candidate for one type or another, but in general, you cannot tell how the facelift was done by just looking at photos or even videos of a patient. And I'm going to go ahead and do a upcoming podcast here where I'm really going to deep dive into these operations, specifically some of these trendy operations like the deep plane facelift and the difference between, let's say, that and some of the other facelift options. Needless to say, with Kris Jenner, I don't know what type of facelift she had done. Her plastic surgeon on his website does not reveal the type of facelift he does, just that he does facelifts. So we do know it's some type of facelift. It's obvious. We just don't know what kind. So that's the first thing. I think there are really 4 main keys to why Kris looks the way she does. Number one is that she had a facelift. Number two, if you look at her photos, I do think she's lost significant amount of weight. Now, there are studies that show and surveys that show that per decade, this is a depressing statistic, I'm real sorry to say this, women gain, I think it's 11 pounds on average per decade. Men gain about, I think, 7 pounds per decade on average here in the United States. And I know we don't like to hear that, but that's what my understanding the surveys will say. And so it's very common, Kris Jenner is 69 years old. It's very common for women who are 69 not to weigh the same as they did when they were 45. So I believe she has lost a significant amount of weight that has created her face to look quite a bit thinner. And that weight could be natural or, I think she lost it in the last year. It could be Ozempic. Technically, Ozempic is not FDA approved for weight loss. Its sister medication, Wegovy, is, but basically a GLP-1 agonist. So I believe that it's definitely possible that she has lost some weight. When you're losing weight pretty rapidly like this, then it's definitely possible she has had assistance with a medication like an Ozempic or one of its sister medications. So that's the second reason why I think she looks the way she does. The third thing is not as obvious, but there are a lot of celebrities who get good-looking facelifts. But why is it that recently facelifts seem to be so much better than they were before? Is it that the techniques are that much better? Or, and this is my hypothesis, the techniques aren't necessarily that much better, but they're not overplumping people's cheeks at the same time. So there has been for the last 10 to 15, maybe more like 10 years or so, maybe 10 to 15, where plastic surgeons have been overplumping up faces. They've been creating these pillow faces where celebrities and their patients look overfilled in the cheeks, overfilled in the lips. They just look unnatural. And even if they get a good facelift that gives them a nice, perfect jawline and neckline, a lot of times you don't even notice that because the rest of their face looks just so distorted from all that filler. So here's a situation now where you have a face that looks thinner than it did before, and very importantly, the filler either was never injected or it was injected in such tiny quantities that it still looks natural. And that, I think, is a huge key here, is that she either has had some of her filler melted, she has had it injected very minimally, or hasn't had it injected at all, because her face looks thinner and it looks more natural than what you may have seen in facelifts 3 or 4 years ago, where doctors are overplumping everything up. And I think that this is something that is really, really important for us to realize, is that the lack of something can make somebody actually look better sometimes. And in this situation, the lack of excess filler can have people look at her and go, wow, they don't even pay attention to her cheeks. They're just looking at her, her nearly impossibly sharp jawline and saying, look at how great that facelift was. And I argue that if she would have had filler, like maybe would have been done 5-7 years ago, we might not be talking so much about how great this facelift was, but just about, oh, she looks overly plump. And so less is more with filler. And, I do a lot of facelifts, and in my facelifts, not uncommonly, we'll inject some fat with it. But also sometimes I don't. It just depends on the facial shape. And we get some patients of mine who have fuller, rounder faces, and I don't inject fat in them because it doesn't make a lot of sense. Then other people who have more of a thinner face, where I will inject fat into their cheeks, into their lips, a certain percentage of that fat will stay, and it can create just a nice natural enhancement of those areas. It adds maybe a week to recovery time just because they're kind of puffy and swollen for a while, but definitely is a nice natural way to add volume but not overdo it. I rarely will inject a hyaluronic acid filler at the time of a facelift surgery because usually if we're going to be there, why not just use fat? The patient's asleep anyway, and the fat can last much longer. And then the second thing, when you're injecting filler, I do believe because you have to inject it so accurately, and you have the ability to do that, it's best to do it when somebody is sitting straight up, not when they're lying flat on their back and things kind of move downward. So less is more with filler. Whether, if you do a facelift and you don't do filler with it, if you've got cheeks that are nice and full already, lips that are full, then there's no reason to add filler or even fat at that time. But if you're not, then you can do fat and get a very subtle change with that that can look very, very natural. So that's the third reason why I think she looks as good as she does and why so many people are like astounded at how amazing she is. Whereas plastic surgeons like myself will look at her and say, yeah, that's a really nice result, but it's not anything out of the ordinary of what a lot of plastic surgeons can do. And then the fourth thing, and this is something too I think that the media hasn't really jumped on yet because I don't think that they've realized, is that there is a sweet spot after a facelift operation where things are nice and tight, the wrinkles are smoothed out, and things look really, really good. And that's about 2 months to maybe about 4 months-ish after surgery. And in that period of time, the skin is still tight, things are still a little bit swollen, enough swollen that the wrinkles are a little smoothed out. And what happens as time goes on is that the skin and the tissues will relax. So very commonly, you have patients who are, 2 months, 3 months out of surgery, things are still nice and tight, they're still a little bit swollen, everything looks great, and you may tell them, you know what, some of these little fine wrinkles are going to come back, things are going to relax, and they won't believe you because they know it looks so good. That's not going to happen, I don't think. And then 6 months after surgery, a year after surgery, they get some relaxation, and you can see things have kind of moved a little bit towards what they started at. Nowhere near what they started with, but a little more towards that. And I think that's where Kris is. We know that she took at least 6 months away from the spotlight. My guess is that the surgery was maybe done about 2 to 4 months ago. So she's still in that sweet spot where she still has a little bit of swelling. Things are still healing, but they're healed enough that she looks really good. But what I do expect is that over the next 6 to 8 months, as you see photos of her, you're going to start seeing a little of that relaxation happening, and that perfectly sharp, kind of crazy sharp jawline is not necessarily going to be quite that sharp 6 months from now. And that is normal because she's 69 years old. The quality of her skin and her soft tissues, the underlying muscles and the fat and the connective tissues, that's what's going to keep everything where it is. It's the quality of the tissues. And because she's 69 years old, she's taking great care of her skin. So for somebody who's her age, she probably has amazing skin, but it's still not the same as the skin of a 55-year-old. And so I would expect that we're going to notice definitely some relaxation, and she's going to look a little more like the old Kris Jenner that we're used to, and a little less like the new Kris Jenner who looks literally like Kim. So this is that sweet spot, that 2 to 4 months where patients after facelifts really oftentimes look amazing. Unfortunately, it doesn't quite last. And with time, that does basically settle down. So those are the four main things, 4 main reasons why I think people are freaking out about how amazing Kris looks is because, number one, she had a great facelift. Once again, what type of procedure was it? We don't know, but she definitely had a facelift from what I can tell. I do think she's lost weight with Ozempic possibly or one of the GLP-1 agonists. Less is more definitely with her filler, or maybe she just didn't have any filler at all, and that combined with weight loss and the fact that she already had nice full cheeks before has really created overall a nice contour of her mid-face or cheek area. And then the final thing is, once again, she's at that sweet spot after facelift surgery, that kind of 2 to 4 month period where things are still tight, still a little bit of swelling, things haven't quite settled that much yet, and I do believe things are going to change over the next 6 months. So we'll see, okay? 6 months from now, remember when you see Kris Jenner and say, Dr. Youn said that she's going to look a little more like the old Kris Jenner that we remember than the new Kris/Kim Kardashian Jenner that we're seeing at this moment. Okay, so I think it's more than just a facelift, though. I did look at her photos more closely, and it does appear to me that she's had some other operations potentially. She may have had an endoscopic brow lift, and that's an operation where you make typically 5 small incisions behind the scalp, and using fiber optic instruments, you elevate the brow into a higher position. Now, sometimes the brow elevation is not all that impressive, and hers, if you look at before and after photos of her, that brow elevation is not super impressive. However, it's enough to where I do think that she may have had that done. The second thing is I do think that she has had an upper and lower blepharoplasty done as well. And so if you look at the photos of her, it does appear that her eyelids are more open now. There's no excess skin. There's no puffy bags under her eyes. And I do think it's possible that she has had an upper blepharoplasty, which removes excess skin of the upper eyelids, leaving her with a little scar in the crease of the upper eyelid, and a lower blepharoplasty, probably a pinch lower blepharoplasty, where the fat of the lower eyelids is removed and a pinch of extra skin is removed with it. That does create a scar right underneath the eyelashes that usually heals really, really nicely. And that's how I do my upper and lower blepharoplasty in my patients, is using those treatments. Those are ways to do it the safest ways possible. And it does appear to me that I think she has had that done, possibly combined with an endoscopic brow lift. To me also, it looks like she underwent a revision rhinoplasty. Her nose does look like it projects a little bit more than it did before. And so how do you do that? Well, possibly she had a rib graft taken where you take a portion of your rib cartilage and you can put that over the dorsum or the top of the nose. And this causes the nose to project more and can look straighter. And to me, that looks like that may have been what was performed. And by creating that kind of projecting dorsum, that projecting nose, then that works very closely with the tightening of the jawline, with the thinning of the face. All of that has worked together to create that younger appearance of Kris Jenner. I also think it's important for us to realize that she is also, her skin looks pristine. Some of this could be due to filters. Definitely she's wearing a lot of makeup, okay? And I tell you that celebrities and their makeup artists are fantastic because I have done a lot of TV. I have met celebrities and have met them up close and personal backstage. And celebrities who I didn't know had a lot of wrinkles surprised me because you can see the wrinkles underneath that makeup. On TV, you can't see it because these makeup artists are so good. But backstage, when you're talking to them and you're really up close, you can see them. Hollywood makeup artists are fantastic. And so I do think she's got a good amount of makeup because her skin does not look like a 69-year-old skin. And some of that could be due to makeup. Some of that could be due to filters, probably both. But I also think that she has undergone skin tightening treatments like Morpheus 8, like fractional laser treatments. These are skin tightening and resurfacing types of treatments that can cause the skin to look tighter, to feel smoother, and to look smoother and less wrinkled. I also think she's had injections of Botox that can also smooth these lines as well as elevate the tail of the brow as well. And so really with Kris Jenner, more is more. With her lately, the only thing where less is more with her is fillers. And that's where I think this is really interesting. And so I do think that what we're going to see, like I said, 6 months from now is not quite the Kris Jenner that you're seeing today. Mark my words. We give that some time, get everything to settle down, and she's going to look a little more like she used to, and that is totally fine. So regarding Kris Jenner, would love to hear what you think about Kris's appearance, and if you think that it was great work, or maybe if it was too much, definitely leave a comment on my social media channels because I do have a couple videos there where I have broken this all down as well. All right, so that is Kris Jenner. Huge news. A lot of plastic surgeons, as well as obviously patients, are shocked, and everybody's kind of speculating exactly what was done. That's what I think as a plastic surgeon who does a lot of facial rejuvenation operations. Okay, so the next one that I thought is interesting is Doja Cat. So let me read from an article about Doja Cat. For those of you who may not know who she is the singer/rapper. She's had a lot of big hits. Say So was huge, and a bunch of other ones. So let me read this article. Doja Cat addresses plastic surgery mishap after breast implant visibly shifts. The 29-year-old singer, whose real name is Amala Lamini, wore an aquamarine colored dress with a plunging neckline to iHeartRadio's Wango Tango event, which laid the abnormality on full display. She preempted any speculation by addressing the difference in her appearance in a post on social media shortly after. "Don't clock my contracted implant, it's all I ask," she wrote on X after she'd posed for pictures at the annual concert. A contracted implant is a complication that can occur following a breast implant, as scar tissue forms around it to create a capsule. Doja has been open about the cosmetic procedures she has received in the past, telling fans that she had undergone liposuction and a breast reduction in March of 2023. At the time, she said that she was 4 days into recovery and that it would take her probably 3 months total to heal. She told another follower in a separate tweet that her breasts had been reduced to a smaller 32C cup size when asked if she had undergone enlargement surgery. So it sounds like in March of 2023, she underwent liposuction and a breast reduction at that time. It's possible that when they say breast reduction, it wasn't a reduction to go from like really large, naturally large breasts, and then you do a reduction and make them smaller because they cause back, neck, and shoulder pain. It may have been that she reduced the size of her implants down from a larger size down to a C cup, but I'm not sure. Either way, what it appears to have happened is that she has developed a capsular contracture on her left breast. And she was wearing a very low-cut dress at that time, showing her left implant to be sitting much higher than her right implant. And this is what can happen when you develop a contracture. So what is a contracture? Well, anytime you have something foreign put into the body, something like an implant that doesn't belong there, the body will react by creating scar tissue around it in everybody. In the vast majority of cases, that scar tissue is nice and thin. And once the tissue heals, a lot of times you don't even know that there's scar tissue there. Okay, and that's considered a good result. And we grade the capsule, the thinness of the scar tissue, on a scale of 1 to 4. 1 is the ideal, and that is super thin and super soft and natural. So once again, you can't even tell there's scar tissue there. A grade 2 is slightly firm. A grade 3 is firm, and grade 4 is rock hard. And there's some people who have capsular contractures that are so severe, they're so hard that they feel literally as hard as a bowling ball. And if you take the implant out, you can find calcifications like the shell of an egg on the inside of it because the body has reacted so aggressively with creating this scar tissue. Now, what happens, once again, is that anybody who has implants will develop this scar tissue pocket around it. And in some people, they get that grade 1 and it's nice and soft. And some people, it's a grade 2, it's slightly firm, but usually considered acceptable. Grade 3 is where it's firm and you're like, yeah, this isn't quite right. And then once again, grade 4 is that rock hard. And what can happen when they become a grade 3, and sometimes even with a grade 2, is that it can cause the implant to elevate on the chest. Now, we don't really know why this happens. There's a lot of hypotheses, but it could be due to biofilm, which is bacteria on the surface of the implant. If there's excessive bleeding around the implant, that can increase the risk of a capsular contracture. And I fully believe that there are some patients that just no matter what you do, their body overreacts to the implant and creates too much capsule. But when this happens, it can cause that implant to sit too high on the chest and make it look very different from the other side. And this is what appears to have happened to Doja Cat. This is not her fault necessarily. This is not her surgeon's fault necessarily. It just happens. And as a plastic surgeon who does a lot of breast implants, I put them in. I do a lot of explants as well. This is the bane of my existence as a plastic surgeon who does a lot of breast implants. Because when this happens, you don't really know why. You can't explain to a patient why. It's kind of random, it usually seems. And the only real effective treatment is to go back to surgery and to remove that scar tissue and put a new implant in. And keep your fingers crossed afterwards that the body doesn't react to the new one like it did the old one. And so that's the next step for Doja Cat. If she does want to treat this, would be to go to surgery and have a surgeon perform what's called a capsulectomy, where the actual scar tissue, that capsule, is cut out and removed, and the implant is replaced with a new one. The reason why we don't use the same implant when we do a capsulectomy is because one of the hypotheses is biofilm, of why this happens, is biofilm. And biofilm basically is a tiny thin layer of bacteria that can coat the surface of an implant, not so much bacteria as to create an infection or an abscess, but just enough to cause the body to react to it so that it creates scar tissue and tries to wall the implant off. And if you have a biofilm and even if you wash that implant off and you use betadine and antiseptic solution and antibiotic solution, doesn't seem to matter. That bacteria can still be on there enough to where if you use that same implant, you have a risk of that biofilm staying there and developing another contracture. And so most plastic surgeons, myself included, if I treat a patient's capsular contracture, almost every time I will switch the implant to a brand new one, in the hopes that maybe the new one will not develop the biofilm like the old one did. And so that's her next step. Unfortunately, when you do this operation, it's not a guarantee it's going to stay soft. It can harden again, which is really frustrating when that happens. It does not happen often, but when it does, it is super frustrating. There's a couple of things that you can do. There is a salvage operation where you literally take radiated pig skin. It's called stratus, radiated pig skin. And if you insert that radiated pig skin into the breast implant pocket and suture it into place, the risk of that capsular contracture coming back is much lower. We do think that radiated pig skin, that stratus, modulates the immune response so that's not quite as aggressive. And so that's one option that you have. It's a little gross when you think about it, of putting the skin of a pig inside your breast, but it does work in most cases. And I usually do that only in salvage operations. When I have a patient, let's say, who's had a couple of contractures, doing a traditional capsulectomy, removing that scar tissue hasn't worked, it's gotten hard again, then I will do a capsulectomy, removing that scar tissue and place that stratus, that radiated pig skin, as a salvage operation. And if you do that, most of the time it does not reharden. The other interesting development over the last really just several months, half a year in plastic surgery, has been the FDA approval of the new Motiva breast implants. And these are breast implants that are the newest generation of implants, which studies show appear to have a lower rate of capsular contracture of 0.5%. And this is much lower than what the established rate of anywhere from 2 to 10% or so with the other implants. And so they've only been FDA approved here in the United States just since late last year. I just started putting these into my patients about a month or two ago. So we'll see if that rate really is significantly lower, but that's what the study so far is showing. And so with Doja Cat, then, if let's say she decides she's going to take care of this, then the treatment would be a capsulectomy, removal of that scar tissue, and then placement of a new implant. Probably the same as what she had before, because she probably wouldn't switch out the right side, just switching out the left. If she does switch both of them out, then it may be worthwhile to look into the Motiva breast implant as a way to lower her rate or her risk of this capsular contracture happening again. And that's what I would talk to her about if she was my patient, which she is not. But if she wants to be my patient, then feel free to give us a call, Doja Cat. All right. So that's Doja Cat's story. So the last one here I want to talk about is Chrissy Teigen. Chrissy Teigen, famous Sports Illustrated swimsuit model, married to John Legend. She has had a number of plastic surgeries before, but this is the latest one. Chrissy Teigen gets hairline lowered in shocking plastic surgery procedure. Chrissy Teigen revealed she got her hairline surgically lowered after alarming fans with her bandaged face on Instagram Live this week. A lot of you are wondering about my hospital pic, which is very understandable, as I gave no explanation, LOL. The Sports Illustrated swimsuit model posted via her Instagram story Friday with a close-up photo of her stitches. I had a hairline lowering procedure. Lost a lot in the front from babies, and it's just very thin up there. When you see it on a carpet, it's always extensions. The Cravings author's face looked swollen, but that didn't stop her from giving a big smile for the camera. In March of 2020, Teigen revealed that she got breast implants when she was 20 years old. Soon after her admission, Teigen shared that she was having the implants removed because she was, quote, just over it, unquote. The following year, Teigen underwent a buccal fat removal surgery to remove fat from her cheeks. And in 2017, Teigen also admitted to getting liposuction in her armpits. So she's had a number of plastic surgeries before, but her latest one is a forehead lowering procedure. So what exactly is that? Well, in people who have a long forehead, and I'm one of them, I have what we call a 5 head, okay, where it's like 5 fingers wide or something like that. There are some people who want to lower that forehead or lower the hairline to make the forehead look shorter, not as high. One way to do that is to make an incision at the front of the hairline and to cut out a strip of your forehead skin and then stitch it shut. So essentially what you're doing is kind of like a brow lift, okay? But what you're doing is you're removing excess skin of the forehead and then advancing the actual scalp forward. that will shorten the distance from the eyebrow to the hairline. But, and this is a huge but, it creates a long scar right across the front of the hairline. Now, I don't care what other plastic surgeons say. There's a lot of plastic surgeons who will say, oh, I cut the scar, I cut the incision to make it so the hair grows through it, or I do a W-plasty where it's a jagged type of a scar that doesn't make it look as obvious. I don't care what people say. I have never seen a forehead scar like that, and what we call an anterior hairline brow lift, a hairline lowering scar. I've never seen one that I thought looked natural. Never, not a single time, because you've got a scar right on the edge of the hairline. And that scar will be visible. Now, yes, the scar can fade with time, but still it can be visible. And a lot of the patients who get this type of procedure done, they get it because their forehead is receding, their hair is receding. And now you have a scar right at the front of the hairline. What happens if it continues to recede? Now you may have literally a scar and then a gap and then where your receded hairline is. So I am not a fan of these types of operations because it may look okay now, but when you wear the hair up, people may see that scar. And the other thing is that, as you get older, you may find that hairline moves back even further. And now you got this big scar up there that you can't really hide. So I know what you may be saying. You're saying, well, Dr. Youn, you're not giving an option, for somebody who then has this issue and they want to do something about it. Well, the good news is there is an option, and that option to me makes so much more sense, and I'm not sure why they don't do this on everybody. And maybe with Chrissy they did and it didn't work for her, but essentially what I like better is instead of surgically removing your forehead skin, why not just do hair transplants to create a new hairline? And you can recreate the hairline with hair transplants. It's done all the time. That is not going to create a visible scar. And if those hair transplants recede, which is much less likely because they're hair transplants, they don't act like the hair at the front of the hairline, that seems to make a lot more sense than giving a person a long scar like that. Now, in Chrissy's case, what's done is done, and I really do hope that she's happy with the result, and I think she very well could be. But in general, if you have a really high hairline and you're thinking of doing something surgical about it, then the thing I would recommend would be to talk to a hair replacement specialist and see if they think that doing a hair transplant to the forehead, to the hairline at the front of the scalp, if that's going to work for you, because I do think that makes much more sense. Now, that can take several months for the hair to grow in. It's very expensive. I don't know, if maybe a little more expensive than doing the hairline procedure where you're creating that scar there. But to me, it seems to make so much more sense. And then another thing you can do is if you're starting to notice the hairline receding a little bit, and I've been doing a little of this myself, probably not enough, is if you use Rogaine or Minoxidil and you put it right at the front of the hairline, that may help slow that process down. And there are things that you can do just in general to help prevent that process from happening, from that hairline from receding. And so women, if you're wearing tight buns, then that can cause traction alopecia, where the hair gets pulled out and you start losing hair up there. So stop putting your hair into tight buns. That can help prevent it. So that's one thing that you can do. For guys who wear baseball caps, I have friends of mine who are losing their hair and they wear baseball caps everywhere. Well, hats can do the same thing. It's traction alopecia. And where it's going to pull first is the hairs on the front of your hairline there. And so limiting the amount of hats that you wear can help. And then once again, putting them in tight buns, that can also help prevent that from happening. So I hope you found this interesting. One thing I've noticed, one thing I haven't done as much on my podcast is cover actual surgery. So definitely let me know if you want me to cover more actual surgery, because it's such a small, there's a large percentage of people who will do skincare. A smaller percentage of them will do in-office treatments like lasers and things. A much smaller percentage will do injections, and then a much smaller percentage of that will do surgery. And because that comprises such a small percentage of my listeners and my viewers, I try not to focus a lot on surgery, even though I'm a plastic surgeon and I operate, 2 days every week. I try not to focus too much time on it because I don't want people to feel as if like, oh, it's just surgery. I'm never going to do surgery, so why would I listen to this? But if you are somebody who's been listening and say, oh, thank God he's talking about surgery, I want to hear more, then definitely leave a comment, leave a rating and review on iTunes or Spotify. And I do read those because I read them here. And that's a great way to let me know if you want me to do some more surgery actual episodes. And if we do get a lot of people that request that, then by all means, I'm happy to do that and focus more on the surgical stuff. So, well, thank you so much, everybody, for watching. Thank you so much for listening. My name is Dr. Anthony Youn, America's Holistic Plastic Surgeon, and this is the Doctor Youn Show. As always, I will leave you with eat real food, use clean skincare, and auto-juvenate before you operate.